About 1.25 million people in the United States are living with type 1 diabetes. When I was 13, I was among the about 40,000 people annually diagnosed with this disorder. Unlike instances where people are diagnosed with type 2, type 1 has its very specific characteristics, but there are still a lot of similarities. However, with type 2, you can gain control more with your food and your diet choices, whereas type 1, you are dependent upon insulin injections. In my years living with this disease, I have encountered a lot of questions because I feel like the general population isn't necessarily informed about type 1. And the most frequent question I get asked is, what is type 1 diabetes? So after hearing my speech today, you will be able to explain what it is, how it's controlled, and some of the complications associated with this disorder. So to begin, the exact cause of type 1 diabetes is unknown. Research suggests, however, that it is an autoimmune response triggered, or it's an autoimmune disease triggered, which triggers your immune system to kill the beta cells within your pancreas, which produce insulin. Now, insulin is a hormone that allows your body and your cells in your body to absorb the glucose that you receive from your food, which gives you energy. Too much glucose in the bloodstream is obviously bad, and we'll go over those reasons later. But the role of glucose in your body is, it is the sugar that you get from your food, or it's also reserved in your liver for instances of like low blood sugar when you haven't eaten in a while. A normal person's body will their liver will start breaking down the glucose and releasing it into the bloodstream so that you don't experience symptoms of low blood sugar. So in a normal person, when you eat, your pancreas secretes insulin to maintain, equilibrium for your blood sugar. Which takes us now to how your diabetes in type 1 is managed. It can only be controlled with insulin, although they do suggest that you eat healthy, exercise regularly, do whatever you can to reduce stress, because that has a big influence on your ability to manage your diabetes as well as your blood sugar levels. There's two different ways to control your diabetes with insulin. That's either with injections or an insulin pump. When you take injections, it's usually, the therapy is a mix of two different kinds. One is a short-acting, which controls or regulates the glucose that you eat or that you intake with meals. And then the long-acting is an insulin that kind of maintains you over 24 hours. And with a pump, you just have the short-acting insulin, but you get like a small dose every hour to maintain your blood sugar levels. So along with the insulin injections, you also have to test your blood sugar multiple times a day. You have to always know where you're at, because that sets the basis of how much insulin you'll give yourself at mealtime. And it lets your physicians know where you're at with your management. Another component of life with type 1 diabetes is you have a lot of doctor's appointments, a lot. You work closely with a close-knit network, which includes your endocrinologist, your dietitian, your diabetes educator, an eye doctor, a dentist, a pharmacist, and your primary care physician. So there's a lot of doctor's appointments involved. So checking your blood sugar, going to doctor's appointments, watching what you eat, and taking insulin. Those are all really big factors in taking care of yourself with type 1 diabetes. Now, to move on to the complications associated with this disorder, low blood sugar is absolutely number one most harmful in the present moment. It's pretty well known that high blood sugar over time can lead to things like your foot being chopped off and things of that nature, but low blood sugar is a really big issue in the now. It can, within a half hour, you can go from being coherent to like having a seizure and being in a coma. So if any of your diabetic friends said they need juice, it's not a joke. So there are also significant risks associated with high blood sugar over long periods of time, which include heart disease. A diabetic person is at greatly increased risk of heart attacks, strokes, angina, and high blood pressure. There's diabetic neuropathy, which is your nerves. It's like the deadening of your nerves, where it starts at like the ends of your limbs, and the high blood sugar will damage the blood vessels and the capillaries, and those nourish your nerves. And yeah, so it starts with like numbness, tingling, goes to shooting pain, and can result in complete loss of sensation in your limbs. And nephropathy, which is kidney damage, is another big one. High blood sugar will damage your kidney's filtration system. So a couple other things, your eyes, it's anything with the blood vessels. The high blood sugar levels in your blood vessels will damage them over time. And your feet, if you have numbness in your feet and you don't realize you just stepped on something sharp or cut yourself, and then being slow healers, diabetics, you know, if you don't check that and you got an open wound on your foot, next thing you know you got gangrene, and next thing you know you don't got a foot. So, yeah. In closing, type 1 diabetes is a chronic illness which requires 24/7 care and vigilance, a lot of testing, a lot of injections, a lot of doctor's appointments, and the consequences of not maintaining adequate blood sugar levels are severe and can be life-threatening and debilitating. So, yeah.